What are the long-term health implications of radioactive iodine therapy? Imagine a treatment that targets your thyroid with radioactive iodine to help manage hyperthyroidism or thyroid cancer. While it often works well, it's important to understand what might happen down the line. Radioactive iodine therapy involves giving a dose of iodine-131 that is absorbed by the thyroid gland, destroying overactive tissue or cancer cells. This approach can be very effective, but it does come with some long-term considerations. One of the most common long-term effects is hypothyroidism. Since the therapy destroys thyroid cells, many patients end up with an underactive thyroid. This means the gland no longer produces enough hormones, which can cause fatigue, weight gain, and depression. Usually, lifelong thyroid hormone replacement therapy is needed to keep metabolism and energy levels balanced. There's also some evidence suggesting a small increased risk of developing other types of cancer later in life. Studies have shown that higher doses of radioactive iodine might be linked to a slightly increased chance of secondary cancers, including breast cancer and blood cancers like leukemia. However, these risks are generally low, and the benefits of controlling thyroid disease often outweigh them. Still, they are important to consider when planning treatment. Many patients experience issues with their salivary glands long after treatment. Dry mouth, swelling, and inflammation of the salivary glands can persist, affecting eating, speaking, and overall comfort. These symptoms can last 4 years and impact quality of life. Other possible long-term effects include inflammation of the thyroid tissue itself, gastrointestinal discomfort, dry eyes, and even some effects on bone marrow. Some research hints at potential cardiovascular impacts, such as a slightly increased risk of irregular heart rhythms or early signs of artery hardening, but more studies are needed to confirm these links. Patients often report that their quality of life can be affected years after treatment. Feelings of fatigue, anxiety, and emotional sensitivity may persist, especially if hypothyroidism develops or if other side effects occur. It's important to remember that individual experiences vary widely. Fertility can be temporarily affected, especially in younger patients, but permanent infertility is rare. There are also some theoretical concerns about genetic effects from radiation exposure, but current evidence does not show a significant risk. Because patients emit radiation for a few days after treatment, safety precautions are necessary. Avoiding close contact with pregnant women, infants, and young children helps protect others from unnecessary exposure. In summary, radioactive iodine therapy is a highly effective treatment for thyroid conditions, but it does carry some long-term risks. These include hypothyroidism, a small increased risk of secondary cancers, salivary gland issues, and possible impacts on heart health and quality of life. It's essential to have ongoing medical follow-up to monitor these effects and to tailor treatment plans to each individual. Always consult with your healthcare provider to understand your specific risks and to develop a plan that best supports your health over the long term.